Alright.
Take out.
Tell them we was your captive audience.
Alright. First, let us imagine that we are having fun in the park with our loved ones. Swings, slides, merry-go-rounds. And you notice a nice older couple enjoying their grandkids. As you play, you notice the older gentleman is a little more sweatier than everyone else. When all of a sudden the older gentleman falls to the ground and you hear the call for help. What do you do? Well, if you know CPR, cardiopulmonary resuscitation, you would go to help. Learning CPR is the first step in knowing what to do when to save someone's life. It's not hard to learn CPR, and it could be the difference between life and death. The first step in performing CPR is to check on responsiveness. If they can respond or not determines the level of help that is needed. If a person is unresponsive, that is, if they don't respond to shouts or shakes, breathing has ceased, or is abnormal, you should call 911. Abnormal breathing can occur when in cardiac arrest. Some people in cardiac arrest can make gasping, grunting, or slowing sounds, which these sounds are not good breathing if still unresponsive. When a person goes into cardiac arrest, the heart stops, the blood pressure falls to 0, and within 10 seconds, the patient loses consciousness. The longer they are without oxygen, the more damage they will suffer, such as brain damage. Starting CPR as soon as possible will greatly decrease these damages. Brain damage starts approximately 4 to 6 minutes after cardiac arrest. Now that we have called 911 to get medical attention, we have to keep the blood and oxygen flowing until they arrive. The next step in CPR is rescue breathing. By tilting the head back, you will be able to tell if they are breathing or not. Use the method called head tilt chin lift to tilt the head back. You put one hand on the forehead, the other under the bony part of the chin, and tilt the head back. Now you can get close enough to tell if they're breathing and look at the rise and fall of the chest. If not breathing, pinch the nose and cover their mouth with your mouth and breathe for about 1 second. After you give the breath, you should feel the breath leave the lungs before the next breath. This whole process should take no more than 10 seconds. You have given your 2 breaths in and out, and now the last step in CPR. The last step in CPR are chest compressions, or pushing on the chest between the nipples about 1.5 inch to 2 inches 30 times. The proper placement of your hands for compressions are 2 fingers above the xiphoid process, which is the small bone at the bottom of the sternum, which is in the middle of the rib cage, center chest. If you guide your fingers up the bottom of the rib cage, you will meet both sides in the middle and can feel the xiphoid process. Chest compressions should be given at least a rate of 100 times a minute. So just a little faster than 1 a second. Give 30 chest compressions to 2 breaths is considered a full cycle of CPR. You should complete 4 cycles within a minute. If you have more than 1 person there to help, one should give rescue breaths while the other gives chest compressions. CPR should be given until medical help arrives. CPR can be the difference between life and death, so shouldn't that be reason enough to learn it? Take the full CPR course and become certified. Thank you.